I'm Dr. Michael Wheeler, orthopedic spine surgeon. Let's talk about red flags that people may have when dealing with back issues. Okay, number one is going to be extensive weakness in their legs that's new in onset. Usually these are going to involve the ankle itself. So people who either have foot drop or they have difficulty pulling their foot up, or plantar flexion weakness, which is the calf muscle, which is pushing off onto your toes, raising your heels off the ground. If you're having new onset severe weakness in your ankle or really anywhere in your legs, that should be evaluated, and that's a red flag. Number two, less common, but maybe even a bigger red flag, is if people have issues with their bowel and their bladder. Okay, when people have an extensive amount of compression in their lumbar spine, usually from some sort of spinal stenosis or a large disc herniation, an extreme amount of pressure on your nerves there can cause dysfunction of the lumbosacral nerve roots. There's a fancy way to describe that the nerves that control your bowel and bladder function don't seem to work as quickly. And in the early stages, this is going to show up as people who have difficulty emptying their bladder all the way. So they feel rushed, they got to go to the restroom immediately, and they're only able to get a small volume of urine out. And then when the pressure continues and the nerve damage progresses, this will progress onto full-blown incontinence where you're having surprises and emptying your bowel and bladder unexpectedly. And although these aren't fun things to talk about, these are major red flags. So if you're experiencing any of these things, you should get evaluated immediately, because these things can become permanent much quicker than you think.